We're just delighted that we're able to have such an unusual topic today, and I guess the size of the crowd sort of indicates that. It's a hard topic to wrestle with. There's so much information available to people, and how people get that information, and maybe coming to a face-to-face lecture is not the way people want to find out about how to look for information on the internet, but it's such an important area for us in the world of cancer that we thought it was very important to have this topic today. So we're delighted that we've got Melissa Sweet here to talk to us about it. Just a little bit about Melissa, and in fact I failed to introduce myself. My name's also Melissa Ledger. I manage the Cancer Smart team at the Cancer Council. And so we have another Melissa joining us just to confuse the situation. We've got two of us. And she's one of Australia's leading health journalists. Melissa will be presenting on how to find credible information about cancer online and learn how to judge what makes a good site. Melissa's an independent journalist. She's a media columnist and an author, blogger and enthusiastic tweeter. Melissa specialises in covering public health matters with a particular focus on underserviced areas and issues. She coordinates Crikey's health blog, Crokey, which you may have heard of, and is also involved in various research and teaching activities and has an honorary appointment as adjunct senior lecturer in the Sydney School of Public Health and at the University of Sydney. Please welcome Melissa today. Thank you.
Thanks very much, Melissa. I don't often get the chance to say that to another Melissa, and thank you everyone for coming out today. Now, I know... are we right? Great. I would like to begin by acknowledging the traditional owners of this land and the elders past and present. And I would also like to thank the Cancer Council for inviting me to participate in this series and the State Library for hosting the event. I'm going to talk, I know the title given was about Google and cancer, but I'm going to talk generally about finding reliable health information online because what applies to health information in general applies to cancer in particular, and also people with an interest in cancer probably have an interest in other areas of health as well, I hope. So we live in tremendously exciting times as a result of the digital revolution and the information revolution. I'm going to just give a little bit of an overview of how rapidly things are changing in that area before I get into the specifics of websites and so on. Just to give you some idea of how much the world has changed, I remember back to when I was the medical writer at the Sydney Morning Herald newspaper in the late 1990s. I used to dread writing stories for the Saturday edition because inevitably on a Friday afternoon my news editors would get excited by a story that was on one of the wire services from one of the international medical journals like the BMJ or the Lancet. Often I would not have access to the full copy of the study but would have to develop a story based upon what the wire service was reporting. I would ring various experts asking them to comment upon a study that they also had not seen. And clearly this was not an ideal situation for my readers. And if you contrast that situation, not so long ago with today, where now anyone, anywhere in the world can access the journal article as long as they have an internet connection or a mobile, and it's staggering to know that of the world's 7 billion people, it's estimated that 87% are mobile phone users. So what's more, if they are really keen, they may be able to have direct access to the authors of that study, assuming the researchers are blogging or tweeting or engaging with social media channels. Perhaps they may even be able to ask those researchers questions, or just as importantly, to give them feedback about how relevant the findings are to people with the actual condition. Just as importantly, they will also have access to informed critique of the research, its findings, and the conclusions drawn from it. They will not have to rely upon the old-fashioned gatekeepers of information, like journalists, or hope that their doctor has had time for keeping up with the latest research findings. So this is the website of the Gutenberg Museum in the German city of Mainz, which was founded by the locals in 1900 to commemorate the 500th anniversary of Gutenberg's birth. The invention of the Gutenberg printing press in the 1400s didn't only transform printing. By enabling the spread of ideas, it had a profound impact upon society and upon the advancement of knowledge and development. Before that time, and I'm sure most of you are not quite old enough to remember before that time, books were copied out by hand in monasteries and were available only to a select few. So the invention of this technology had a huge impact upon society. I'm quoting about that from Wikipedia, and Wikipedia, if you think about it, is itself a revolutionary byproduct, particularly if you used to work for Britannica. So Wikipedia says of the Gutenberg printing press, the relatively unrestricted circulation of information and revolutionary ideas transcended borders, captured the masses in the Reformation, and threatened the power of political and religious authorities. The sharp increase in literacy broke the monopoly of the literate elite on education and learning and bolstered the emerging middle class. The printing press was also a factor in the establishment of a community of scientists who could easily communicate their discoveries through the establishment of widely disseminated scholarly journals, helping to bring on the scientific revolution. So that's according to Wikipedia, and many argue that we are in the early stages of a transformation or revolution on a scale with the aftermath of Gutenberg. So moving on to the digital revolution. This is the cover of a fantastic book which, if you're interested in the digital revolution and the broader context to Google, I really recommend. It's by a US journalism entrepreneur and academic called Jeff Jarvis. It was published in 2009, and he's since done another book called Public Parts, How Sharing in the Digital Age Improves the Way We Live and Work. So I recommend both of these books for their insights into the digital revolution and how it is transforming business, society, governments, and how people live their lives, as well as, of course, how they access health information. Incidentally, the last time I looked, Jeff Jarvis had almost 100,000 followers on Twitter, which is a bigger readership than many Australian newspapers. Jarvis says the idea behind this book is to reverse engineer the success of the fastest growing company in the history of the world, the one company that truly understands how to succeed in the internet age, and then take those lessons and apply them to a number of industries, companies and institutions, from car makers to restaurants to universities to government. He also gives a few health examples in the book. The key themes from the book are that we live and work in revolutionary times as the internet democratises information, blurs roles, enables the development of new networks and collaborations and greater participation, such as we've seen with the development of websites to enable patient-led research. So this is an example of a website from the Australian government, My Hospitals. I keep wanting to call it Our Hospitals. And it's an example of increasing transparency in the digital age. It's a reminder that this is a time of changing expectations and challenges to existing business models and business as usual approaches. So the digital era is enabling, or in some cases forcing, greater engagement, accountability and transparency upon us all, whether upon individual health professionals or service providers or organisations and institutions. So they're exciting times, but they're also challenging and confronting. Revolutions are never easy, certainly not predictable, and there are inevitably casualties along the way. To make the most of the digital revolution, we all need to develop some digital literacy skills. We need the skills to ensure that Google is our friend and ally rather than a troublemaker. By us all, I mean health organisations and services, health professionals and patients, and the wider community. Health literacy is formally defined as the ability to understand health information and to use that information to make good decisions about your health and medical care. Health information can be overwhelming even for people with advanced literacy skills. According to the latest stocktake of our health, the Australian Institute of Health and Welfare's comprehensive report called Australia's Health 2012, the latest data show that only 4 out of 10 Australians aged 15 to 74 had a level of health literacy that was adequate or above. In other words, 6 out of 10 of us are not able to understand health information well enough in order to make good decisions about our health. The health literacy rate was even lower amongst people living in more disadvantaged areas, people living outside the major cities, among older people, and among people who rated their health as poorer. So it is likely that our digital health literacy skills are even lower than our general health literacy skills. In its 2009 report, the National Health and Hospitals Reform Commission identified the need to improve health literacy as a key national health reform direction for Australia. The point of mentioning all this is that the health and other sectors need to be doing far more to help people, particularly those who are disadvantaged and also more likely to be in poor health, to develop not only a greater level of health literacy, but also of digital health literacy. It's not useful or fair to expect individuals, particularly those grappling with poor health or other struggles, to be able to make the most of the Google revolution without providing them with some support and training to do this. This is particularly critical given that so much of the health information in cyberspace is misleading and even harmful. We need, as a society and as individuals, to develop better skills in sifting the wheat from the chaff when it comes to health information, to understand some basic criteria for evaluating health information, whether it comes from Facebook, Twitter, a magazine, or our pharmacy. Health is big business. It's not only a service provider. Many people are selling something, and it is often difficult to distinguish between what is marketing and what is reliable, objective health information. Fortunately, over the past decade or so, more and more resources have become available to help the general public be more informed about health advice and information. I'm going to present a few of these and some of the key tips from each of them. Most of them are freely available via Google, so if you Google the names that I give, you'll be able to access them for yourselves. So I hope you don't mind if I start with something that I've been involved with, and just given my comment to be wary of people selling something, I should point out that this book is freely available online, both via the University of Sydney's website. It also has its own website, and you can also read a web version of it on the US National Library of Medicine bookshelf. So my co-authors on the book are some academics at the University of Sydney. And the clip on the website is Dr. Lyndel Trevino, who's a GP who's got a passion for helping patients in the wider community better understand health information. So you can listen to her clip as well as read the book if you like. So the book was first published in 1999 and a second edition came out in 2008. So some of the actual examples in it may be outdated, knowledge changes. However, the general principles still apply. Some of these include beware of the assumption that if something works on a rat, it will work on you. We often read reports that a certain product has been scientifically proven to have various benefits or some new breakthrough in the news, but then the fine print reveals that the results actually come from laboratory or animal experiments. And it cannot be assumed that these results will be relevant for humans, and I think a lot of people get false hope from stories based on those sort of studies. And one example, quite famous, I guess, is that for years people were encouraged to take antioxidant vitamins to reduce the risk of certain cancers and heart disease. And these were on the basis of animal studies as well as some studies in humans, but they weren't the rigorous type of studies that can prove cause and effect. So for years people were told to take these or advised to take these vitamins, and when they actually did proper randomised control trials and reviews looking at the impact of taking these supplements, it seems that people who took them were more likely to have harmful events or even a higher rate of death. So, it shows the example. It's a powerful example to me of the dangers of relying on unreliable evidence for your health advice or what's being advertised. Another key theme from the book is that association does not equal causation. So we often hear of studies showing, for example, that drinking coffee causes cancer, or perhaps that drinking coffee prevents cancer. But what we don't hear so often is that these sort of studies are not capable of showing cause and effect. They're only showing an association between two events. So be very sceptical of studies that are, claiming to show cause and effect when really they're only showing an association between two events. And so for an example of that, excuse me, what, for example, would you think of a newspaper report that said a certain substance caused many major diseases on the evidence that 99% of all people who die from cancer had eaten it, and that most sick people had also eaten it? Would that make you a bit nervous about trying it? What if another article noted that 99% of people involved in air and car crashes had eaten carrots within 60 days preceding the accident, and that 93% of criminals come from homes where carrots are served frequently? So would you stop eating carrots? So that's an example of, association rather than cause and effect. Another key theme from the book is the importance of understanding the natural history of a condition. Many diseases get better with or without treatment, and it's impossible to know whether a treatment actually worked unless you know for sure what would have happened in the absence of treatment. The book has a summary of how to improve the quality of your health care and to sift the good health advice from the masses of bad information that's out there. And the key tips are to think critically, to understand probability, to understand the importance of asking how probable the harms and benefits of health interventions are, to beware of anecdotes, and I think this is one of the most powerful pitfalls that we all fall into. Anecdotes, an individual story can be very powerful and sound compelling, but what works for one person may not work for another, and it may not even have worked for that person. It might just sound like it did. So for most tests and treatments, you cannot infer a general rule from a single experience, especially if it's not your own. The book also recommends asking your practitioner for evidence about the outcomes that matter to people. So this is about the idea of what does the intervention, the test or treatment actually do for my quality of life or my quantity of life, about being cautious about the use of surrogate measures. So often you'll hear that such and such treatment, reduce certain blood markers or proteins or whatever, and that's a surrogate measure, assuming that will mean better health outcomes. But we know from experience that often a promising improvement in a surrogate measure doesn't necessarily translate into better health outcomes. Other themes from the book: newer is not necessarily better. Often you're hearing about new tests and treatments because someone has an interest in promoting them, and often we find out, we realise with time that what was once the sort of so-called miracle new treatment in fact wasn't quite such a miracle, and in fact quite often isn't any better than existing treatment. So I guess the underlying message of that book is be sceptical. And Les Erwig, who's Professor of Epidemiology at University of Sydney, drew up these 5 key questions, which are really at the heart of the book. So they are: what will happen if I wait and watch? So that's going back to that idea about the natural history. What are my test or treatment options? What are the benefits and harms of these options? How do the benefits and harms weigh up for me? So that comes back to the idea of personal preference. You can get some sort of probabilistic understanding of benefits and harms, but one person may feel quite differently about them to another. And finally, do I have enough information to make a choice? And then if the answer is no, the book gives you some ideas for how you can go back and try and find better information. In another book that I co-authored with a colleague, Ray Moynihan, called 10 Questions You Must Ask Your Doctor, we also suggested asking whether your healthcare professional has any financial or other ties to the companies whose products they are recommending. In the US, it is now possible to search online databases to see whether healthcare services or providers have received funding from pharmaceutical or other commercial interests. There is now a wealth of really useful, freely available books online for helping you assess better health information. So back to Googling, this is another one. You can Google testing treatments, which has many of the themes of smart health choices, and it's by some English researchers and also patient advocates involved in it. In the introduction to the book, the British scientist and author and columnist Ben Goldacre, and if you read Ben's work, he also writes a column for The Guardian, and you can follow him on Twitter. He's a very entertaining, quite naughty sort of person, with obviously a great brain as well, but he makes deconstruction of science very entertaining. He says, not all trials are born the same because there are so many ways that a piece of scientific research can be biased and erroneously give what someone somewhere thinks should be the right answer. He says doctors, patients, professors, nurses, occupational therapists and managers can all become wedded to the idea that one true treatment in which they have invested so much personal energy is golden. He says sometimes evidence can be distorted for other reasons. It would be wrong to fall into shallow conspiracy theories about the pharmaceutical industry. They have brought huge life-saving advances. But there is a lot of money at stake in some research, and for reasons you will see in this book, 90% of trials are conducted by industry. This can be a problem when studies funded by industry are 4 times more likely to have a positive result for the sponsor's drug than independently funded trials. So that's getting back to the idea of, knowing the interests involved, knowing who is funding research or promoting research findings. More useful reading. This is a slim book. It's written by a veteran health journalist in the US called Gary Schweitzer, and he wrote it for the Association of Healthcare Journalists. And you can also follow Gary on Twitter or read his blogs. It's directed at journalists who report on research, but it's also got very useful reading for patients and those who are interested in being more proactive about their healthcare. It's not freely available, but you can buy it. It's free to Association of Healthcare Journalists members, but if anyone here wants a copy, I'm happy to email you a PDF of it. In the book, I don't know if you can read that okay, but Gary sets out a pyramid of the hierarchy of evidence and making the point that not all studies are the same. And you can see up the top the sort of gold standard of evidence, systematic reviews, meta-analyses, randomised controlled trials, and down the bottom, ideas, opinions, case reports, and so on. And I don't think it's any coincidence he's got, the weight down the bottom, because that's what we tend to hear a lot about, the poorer quality evidence rather than the better quality evidence up the top. So he basically says that if journalists are relying on medical journals as the main source of their news, you are getting and giving an imbalanced view of new treatments, tests, products and procedures, because both industry interests and journal policies tend to promote positive findings. He says if journalists rely on presentations at scientific meetings as a main source of their news, they may be promoting claims that have not been validated by any independent expert sources. He recommends a range of resources for further reading, and one of them happens to be one of my favourite online sources for informed critique of health news stories, and that's the NHS Behind the Headlines service, which again you can Google, freely available. Just Google Behind the Headlines and NHS. So this service provides an unbiased, or aims to provide an unbiased and evidence-based analysis of health stories that make the news. Because news is global these days, most of the site's analyses are also helpful for Australian media consumers. So if there's a big story in the Australian media, it's quite likely that you'll be able to read a good analysis of it there. The service is aimed at both the public and health professionals and aims to both give people a better understanding of the evidence behind the headlines and be a trusted resource for journalists and others involved in disseminating health news. So Muir Gray, who set up the service in 2007, says, scientists hate disease and want to see it conquered, but this can lead to them taking an overly optimistic view of their discoveries, which is often reflected in the newspaper headlines. In the 21st century, he says, knowledge is the key element to improving health. In the same way that people need clear, clean water, they have a right to clean, clear knowledge. As you can see down the side, there's subcategories of stories, and the site has analysed more than 400 articles related to cancer. So you might be interested to have a look at some of them, because I'm sure some of them will ring bells for you. So Behind the Headlines provides a terrific service. I recommend signing up for their email alerts, and you can also follow them on Twitter and Facebook. So back to Gary Schwitzer. This is a snap from his website called Health News Review, which is funded by a health charity in the US. It provides a structured analysis of news stories about health and medicine, as well as a highly entertaining and no-holds-barred blog about media coverage. Gary doesn't mind letting you know when he thinks journalists and the media have done a bad job. The criteria used by Gary and his team of well-qualified reviewers to assess media reports include whether they address the following criteria. What's the total cost? How often do benefits occur? How often do harms occur? How strong is the evidence? Is this condition being exaggerated? Are there alternative options? Is this really a new approach? Is it available to me? Who's promoting this? And do they have a conflict of interest? So I think they're pretty good questions to ask of any source of health information that you find. In one of his blogs, Schwitzer says that when he was a young reporter in Milwaukee, a local comedian was arrested for publicly performing what was then becoming a popular part of his routine: the 7 words you can't say on television. So over a 25-year career in medical journalism, Schwitzer has developed his own list of taboo items, all of which he says appear in print and on the public airwaves too frequently. This is his list of the 7 words that shouldn't be used in medical news stories, and perhaps it's a good list too when you're looking at websites to see if they use this sort of terminology. He says, I urge consumers of all healthcare information to be wary of these words because they mean different things to different people. And he urges healthcare providers and professional communicators to stop using them. So one of the words he really doesn't like is cure. He says, does it mean absence of disease? Does it mean no recurrence of once existing disease? Does it mean today, next week, 5 years, or a normal life expectancy? Does it mean the same things to doctors as it does to those they treat? He says the term can be as meaningless as expert, which has been defined as anyone talking about anything more than 25 miles away from home, which I guess means me. I think I'm more than 25 miles away from home. So he also doesn't like the word miracle. He says, miracle lost its lustre after I talked with a man who had undergone a successful lung transplant. The man had heard others describe the procedure and his outcome as a miracle. He said, This was no miracle. Moses didn't come down and part my chest with his staff. A surgeon did it with a knife, and it hurt, and I had a lot of problems afterwards. I'm very grateful, but this was no miracle. Schweitzer says there is no need to elevate the accomplishments of medicine to a supernatural level. They are worthy of admiration for what they are. Tremendous achievements by highly trained, caring professionals working with healthcare consumers who must do their part to increase the likelihood of a successful outcome. This reality may be lost when we say miracle. Another word that he doesn't like, and which is also a bugbear of mine and many others, is breakthrough. He says, some healthcare communicators and journalists love to slap the label of breakthrough on many advances in medicine. The use of breakthrough would be less offensive if the writers who use it also would agree to publish a long-term follow-up of how many breakthroughs actually panned out. He says, a warning to healthcare consumers, be careful about putting too much stock in any claim made by medicine or the media if it uses the term breakthrough. True breakthroughs are better measured over years, not overnight. He has other words that he has an allergy to. One of them is victim. He says, people hate being called a victim. Many even hate being called patients. Victim should not be applied to someone with a disease or a health condition. He says it should be reserved for those healthcare consumers and news consumers who are victimised by claims of cure, purveyors of false hope, or by those who promise dramatic, miraculous breakthroughs. He says, let's drop these misleading and dangerous words from our dialogue about healthcare. So I think that's a good tip for when you're looking at websites to avoid those using those sort of terminology. So we can be proud that Gary's Health News Review and several similar initiatives around the world are modelled on this Australian innovation, which is Media Doctor Australia. You can see there, hopefully, that it's a site that also analyses stories in the news, and that's an analysis it's done of a recent story about a breast cancer treatment. But we can be less proud of the fact, I think, that this site is now struggling to continue its work due to lack of funding. It's really been running on the smell of an oily rag. I think it's like $3,000 a year for years, and I think it's such a shame that it's probably going to close down later this year, given the importance that the media has in affecting individuals' behaviour and healthcare. So if there's any philanthropists in the audience, this is a worthy initiative that deserves to be kept going, and I think, in fact, it should be expanded and enhanced rather than let it slip away. So having been so critical of media coverage of health, there is some very good work being done. And one of the virtues of the internet age is that we now have access to some of the world's best health journalism. We're not limited to, whatever happens to be the morning newspaper in our town or what's on the news that night. I personally have often been jealous of the resources available to health journalists in the US in particular, where some very good work is done. For example, by not-for-profit journalism outfits like ProPublica. They're at the forefront not only of doing in-depth health investigations, but also of being innovative in how they do them. And for example, they recently set up a new Facebook community around the issue of patient harm, people who suffer adverse events as a result of their health care. So I presume it's open to anyone in the world. So if that's of interest to you, it's a place that aims to bring together patients and the wider community, as well as healthcare services and providers and experts in patient safety. So it's sort of an example of how the world is changing. So this site, which is part of the New York Times, this is a publication. They have guidelines and best practices for using the internet to research health and medical information. It says, when it's time for you to learn more about your diagnosis or options for treatment, then the internet should be one of the first places you go. The breadth and depth of information is astounding, almost overwhelming, sometimes highly accurate and useful, and other times totally worthless. Remember that anyone can publish anything they want on the internet, true or false. It's up to you to determine which information is true and credible. And to that I'd add, hopefully it's something that you can also discuss with your health practitioner. This website says, trust your intuition. Like the adage, if it seems too good to be true, then it probably is. These guidelines say stick with well-respected health websites for the most credible and objective information. And I'd underline that. Generally, I don't recommend it. I don't do it myself, just Googling a condition or question. Google it with the name of the relevant reputable organisation, or go to the organisation's website and search there. So, for example, the Cancer Councils. If you do want to just Google a condition, bypass Google and go to Google Scholar, because at least that's taking you to the scientific literature, although it will give you an overwhelming number of publications, and that can be daunting in itself. So speaking of reputable sources, are you familiar with the Cochrane Collaboration? Yes? Any? No? Okay, good. Okay, so the Cochrane Collaboration is an international group dedicated to compiling the best evidence for various treatments and interventions, not just sort of healthcare treatments and interventions, but also they do some work around public health interventions as well. So for Australians, their resources are freely available. They publish systematic reviews of different interventions, and I'm sure if you search on the website under whatever your area of interest is, there will be a lot of information there. They also publish plain English summaries of the findings. So it's very much aimed at the general public as well as healthcare services and professionals. And what they're featuring on their homepage there is a book that they recently published. It's not freely available, there is a charge to it, but it's about how to assist to have improved communication in between patients and health providers. So Cochrane Collaboration, it's one of the sites I would always go to first if I'm researching a story, so I recommend that. So sharing experiences. This is another online database, except very different to the Cochrane Collaboration, because it's not about compiling the results of scientific research, it's about compiling patient experiences. And to me, it's a reminder that one of the pluses of the internet is that it's not only facilitating passive consumption of information, but facilitating contributing and sharing. So this website lets you share in the experiences of more than 2,000 people with over 60 health-related conditions and illnesses. You can watch video, listen to audio clips, read about people's experiences if you prefer, and also links into reliable information about specific conditions, choices and support. So it's the information is based on qualitative research into health experiences, and it's led by experts at the University of Oxford. On a similar note, this is a publication from the Millbank Memorial Fund in the United States, which is a health policy type of organisation. It was a review looking at how online patient experiences can affect health, and it identified several areas where online sharing and participation can have implications for health. Interestingly, it said there's both potential for positive and negative impacts, so it gets back to that idea that, you know, Google can be your friend or your foe. But some of the identified domains, some of the domains they identified were for finding information, for feeling supported, for maintaining relationships with others, for affecting behaviour and experiencing health services. Other domains which they said had less attention were learning how to tell the story, your story, and visualising disease. This paper said that the value of first-person accounts, the appeal and memorability of stories, and the need to make contact with peers all strongly suggest that reading and hearing others' accounts of their own experiences of health and illness will remain a key feature of e-health. The act of participating in the creation of health information, for example through blogging and contributing to social networking on health topics, also influences patients' experiences and has implications for our understanding of their role in their own healthcare management and information. So in other words, you know, the digital revolution is about much more than accessing information, but it's also about engaging and participating. So, you know, there's unrivaled opportunities for doing that now compared to, if I think back to the 1990s when I was at the Sydney Morning Herald, for example. So finally, just to end, if you're interested, I sort of write mainly or cover mainly health policy and public health rather than much clinical information. But I have a great interest in how the social media and digital revolution is changing the dynamics of health and healthcare. So if you are interested, that's where I tweet and blog at. Croaky is the name of the health blog, and that's the Twitter name, Croaky Blog. So I use it as a news channel basically to share information. And just to acknowledge, Croaky is an unusual beast. It's sort of an example of how new collaborations can arise in the digital age. So it sits on a commercial media's website, which is Crikey, but it receives funding via a consortium of public health groups, and those are the groups. And I have to say, it's not the cashed up end of the healthcare sector. They're membership based and often not particularly resource rich groups. So I'm very pleased that they support Crikey. And I should say that they've all signed a memorandum of editorial independence, so they don't have any control or seek to exert control over editorial, which is, a big step, I think, for health organisations. Example, again, of the changing dynamics in the digital age. Now, I have got a long list of websites that I find useful or I thought might be useful to you, but there's no point just banging them all up. If I can email them to people, if you'd like, with any of the resources that I mentioned. So I guess if anyone wants that, perhaps I could get your email address at the end of the session. So that's about all from me. If you've got any questions.
Don't go anywhere, Melissa.
Okay.
We'll see if there's any questions from our audience. But before we take the questions, I wouldn't mind just saying that if you are interested in receiving any information from Melissa, we do have some forms out the front there that you can fill in, and we can get your details and make sure that we can get those, rather than having scraps of paper lying around places with
that
emails.
sounds good.
So if you are interested, please see our staff out the front. But does anyone have any questions for Melissa on what's a really bit of a spider's web, really, of information? Yeah, we've got one over there. Just wait for the microphone if you don't mind. It's just coming.
How do the doctors and specialists fare in all of this in terms of them keeping up with information? Used to be that they used to probably just read a few journal articles every month and keep up to date. How much additional pressure does this type of environment, the online environment, place on our doctors to be up with the good and the bad information that's out there?
Well, I think it's, you can always see the glass as half full or half empty. I think everyone, not only healthcare professionals feel overwhelmed by the information overload, but I think gradually we'll develop more and more better tools for aggregating the content that's relevant and useful for us. So hopefully, that will be for everyone, whatever your needs. So it could be for health professionals or it could be for health care consumers and the wider community. I think that is a huge challenge. And again, rather than putting it on the individual health professional, I think it's about developing better systems. So instead of having every health professional develop their own system, I think services and organisations need to be supporting individuals to do that, whether it's health professionals or whether it's health consumers. But I think that is one of the major challenges of the digital age. As someone whose working day seems to have grown about 2 hours as a result of having access to much more information. Terrifically enriching, but also quite exhausting.
Any further questions?
Thanks, Melissa, for a wonderful overview and very honest overview about the challenges for journalists in health information, in particular, from our minds, cancer. Those 7 cardinal sins in terms of those words, I've always wondered, is it the journalist that's driving it, or is it sometimes the editor that's just trying to flog an extra couple of papers?
Well, it's interesting. I think it begins before that even, and Media Doctor Australia actually did an analysis of cancer stories in the media, a study looking at the attributes of them, and actually they found a lot of those words were being driven by the researchers themselves. So, I think it's all levels, and there's quite a lot of studies and papers in the journals supporting this. So, yes, of course, journalists and media organisations could do better, but so could journal editors, how they write their press releases. There's been studies showing that press releases often don't actually give very good information about the papers that they're describing, often making them sound more exciting than they really are, because, of course, the journal wants the publicity. So I think there's a whole lot of players all along that need to be conscious of these issues. But the wonderful thing of the digital age is that everyone is held much more accountable. So, back in the day, for example, in the 90s when I was talking about, my reports were definitely inadequate, but I wasn't being held accountable, and neither were all the people along the way. In the way that people are now, you make a mistake and, there's a lot of people online quite happy to point it out, which, I think is a positive thing. Challenging, but positive.
Another one up here.
Get into those list of words. How much of it is actually public and money orientated? And what I'm talking about, no longer do we have. Years ago, CSIRO was very, very big in research here in Australia, and a lot of funding went by the wayside, which then meant it had to be independent bodies to do it, and research does cost money. Now, for people in the... I know of public companies that were involved in research, but bottom line is the people doing it have to be paid. To get money out of you to invest in the company, you've got to have something. So, again, there's money there. So how much of it is cure to get the dollar out of your pocket to do it? So how much is it public dollar orientated?
It's a huge, huge driver, I think. I mean, there's been some interesting work looking at the biotech industry and, you know, when a company's about to float or whatever, and then all of a sudden you see a spate of news stories saying, you know, we're on the verge of finding a cure for something related to this company's product or research. So, you know, obviously I think it's a huge driver generally. But, I mean, one of the things of the digital revolution is it is changing the whole paradigm in a lot of ways, in that, you know, traditional ways of doing research, traditional ways of reporting research, it's all going to be quite transformed, I think, you know, the way research is done, the way it's written up, published. I mean, I think Britain is moving to making all publicly funded research publicly available. The business model for journals is very uncertain for the future. There's more and more research is going direct to the public, the community, crowdsourcing not only people to be involved in research, but crowdsourcing what the community wants from research. So I think the whole dynamic is changing quite a lot.
Thanks, Melissa. Good job. There's a thought that, look, nothing's new. Everything's just reinvented and brought back from the past. And if that is so, could it be that there's a lot of success stories out there that have got a lot of merit, and there needs to be maybe a worldwide organisation like CSIRO that could just tap into that and find the common threads throughout? Is there thoughts along those lines that could happen, or has happened, or a credible organisation to put it all together?
There's lots of databases of different... actually, I'll try and write some written down here. There are quite a few databases. For example, there's a database of uncertainty about the effects of treatment. I mean, some of these are in this list, but there is, you know, a lot of different international collaborations that are attempting to stockpile different aspects of research or treatments. So I don't know if your specific one is already being undertaken, but certainly I think the power of the web is to enable people right around the world to, you know, who have a particular area of interest to come together and support, whether it's collation of existing research or to promote different types of research.
Is there one site that you look at that is close to what I said?
Well, Cochrane Collaboration in the sense in that they're collecting the results of all the, you know, reliable trials from different types of intervention. The Cochrane Collaboration that I put up before, COCH. Yeah. Well, I don't know. Other people may have suggestions. Yeah.
I'm just following in that vein of... I read Michael J. Fox's book to do with Parkinson's and all the rest, and with a lot of what he had. And basically, the bottom line was all the money for the research, etc., etc. He wanted it into one body, which was to be shared for everybody across the world. So any type of research or findings, anything there, but to be widely open to anyone and everybody, and he's got it they set it up in all different, media forms, so the electronic media and the written media and so on through. Now, that's Parkinson's. Now, are there things similar to that with specific, other than just Parkinson's, but other things like that? You've got the Cochrane, but specific things similar to that type of thing.
I mean, I mentioned cancer people would know cancer-specific stuff much more than I do. I mean, I just know one because I happen to be talking to someone from Sydney Uni about their plans to do something in this area for intensive care for newborns, so that they're planning to do, a central website of all the research evidence and to bring together all the different people involved, from parents and community to the researchers and clinicians. So, I think there's going to be more and more things like that. But in terms of cancer-specific, does anyone...
Well, there's so few cancer funding research bodies in Australia that if that's what you mean, all of the money's pooled and then you apply for that money. I mean, that is essentially what happens. And that is what happens, I guess, that there are large government bodies or peak non-government bodies that have funds of money available, and researchers apply to those funds. So there's not large numbers of research funding bodies because it's expensive, and there's not a lot of cancer research funding other than a few peak bodies within Australia, and I think that's sort of similar in other places.
The National Health and Medical Research Council, NHMRC. They're worthwhile having a look because they're probably the Australian government's biggest funder of medical research, and they cover the whole spectrum, the whole array of diseases and conditions, and they will put out position statements on certain things, and they'll put out summaries of evidence, and they're a really useful resource. But in terms of pooling funding, they work very closely with universities and with all sorts of research institutes and bodies. So that's probably a picture of what you're describing in Australia to an extent. I mean, they certainly are one of the central repositories for funding for all sorts of research in Australia. The National Health and Medical Research, NHMRC Centre. Council. Thanks.
Look, unless there's any questions,
I've
got one more down the front. Lovely.
Thank you for that presentation. How much infiltration is there by the drug companies into these sites?
Into these sites that I mentioned?
Yeah.
I'd have to go through and look, but most of the ones I've put up are independent ones. I think that is a huge issue, that not just for pharmaceutical companies, but also device companies, and there's a whole lot of other industries that also affect our health, and there's a lot. I mean, I saw one recently in the States which was about ageing, and then when you saw the small print, it was funded by Pfizer, but it had a lot of consumer and health advocacy groups. They were the big names on the site, the front, but it was being funded by pharma. So I think it's really important to look at who's funding initiatives, and certainly I prefer to go to the independently run ones. So I think that's a huge issue. It's a challenging issue because the consumer health groups, they're often running on a lot of enthusiasm and not necessarily a lot of funding, and so you can understand why a lot of them have gone to pharma companies and things like that. But to me, it is a concern at the end of the day, because you have to be clear about what the agenda is of any initiative.
All right. I think we'll leave it there. If you could please join me again in thanking Melissa for her presentation.